Just giving your colleague a chance. Iko sawa, eh? Okay. Ladies and gentlemen, good afternoon, members of the press, and welcome to this end of our meeting, our conference here, related to the universal health coverage, otherwise known as UHC. This morning, fellow Kenyans, we had very fruitful deliberations with the Council of Governors, basically on the issue of universal health care scheme that we hope will be launched by His Excellency President Uhuru Muigai Kenyatta tomorrow. The UHC is at the center of the Big Four agenda in terms of health and is a major milestone in terms of ensuring that all Kenyans are accorded quality and affordable health care. For a long time, the issue of quality health care has been associated with private facilities. However, with the rollout of the UHC, this is bound to change as we reform NHIF to deliver UHC. It's a shame that NHIF has actually more certified public facilities, yet spends less on them in resource terms because of the quality of those facilities. Interestingly, the health-seeking behavior of our people signals their level of confidence in our public facilities, which is very low. Consequently, we note that majority of our people seek healthcare services in private facilities, hence a higher pay by NHIF to these facilities. The scheme we are launching will seek to have more Kenyans registered on the NHIF platform and thereby increasing capacity for NHIF to offer better services. The service will also see the standardization of payments by NHIF across health facilities so as to bring all facilities to the same levels of specific reimbursements. We should not have a system of care for the poor and the rich in this country, and UHC will ensure that we offer the same level of services across the counties and across the country. Let me just emphasize that the cooperation that we have seen today between ourselves as a national government and the county governments through the governors here present today is the continuing new way of doing things in terms of levels of collaboration. I want to thank each and every governor who is here through the chair, Governor Oparanya, for the continued effort that we are jointly making for the provision of healthcare to our people. As I said yesterday, the job that we have as leaders is to ensure that Kenyans are happy. For us in health is to ensure that a patient walks out happily, is to ensure that we can prevent disease. But if indeed the disease comes, is to ensure that they can get proper service, we can put a smile on a patient's face. If we really focus and understand what our job is to serve Kenyans, and UHC is a symbol and symbolizes this effort that a government is supposed to respond to the needs of its people. Before I proceed any further, I want to hand over to Governor Oparanya, who will read for us. We have agreed upon, as I said, during the beginning of the process. Today is a beginning. We are not ending. It is not something that we are going to finish in a day. We are neither going to solve, or we are not even going to solve all the problems that we can face within UHC in a day. But we have decided, as a team interested in helping Kenyans, we have decided to begin the journey. So before I proceed, let me invite Governor Oparanya to first of all read the communique, and then I can refer a little bit to the COVID issues of the day.
Thank you very much, CS. This is a joint communique for the meeting held today, 30th October 2020. The meeting we held today is called the Health Sector Intergovernmental Forum on Universal Health Coverage, UHC, held today at White Sands Hotel. Both the Council of Governors and the Ministry of Health, they commit to adopt and implement the recommendation of the Intergovernmental Sector Forum on Health as stipulated as follows. 1, on UHC policy, it was agreed, Ministry of Health, to finalize the process in consultation with the stakeholders, including county governments. Number 2, on financing of UHC, we have agreed that they must establish a UHC fund at the national level, but on establishing a UHC fund, there should be consultation with county governments. On insurance model, we have agreed that we get a mechanism that will guarantee financing for primary health care and preventive and promotive health care to achieve UHC. We have agreed that we finalize National Health Insurance Fund reforms. That institution, NHIF, should be reformed in order for us to achieve UHC. And then we have agreed to review the NHIF we have agreed this should be carried out based on country needs. And any issue unresolved around doctors' postgraduate training should be resolved within the next 60 days, so that from 1st July we will have a different system of training, a program of training postgraduate teachers. 1st January 2021. And then we shall fast track college training at level 5 and level 6 facilities. On recruitment of UHC health workers, we have agreed Ministry of Health to transfer payroll costs to county public service boards as soon as recruitment is completed and returns made by 1st January 2021. And future recruitment of health workers will be undertaken by respective county public service boards. On community health volunteer training payments, we have agreed that the ministry will enhance communication with the Council of Governors and counties on future engagement, and the Ministry of Health to avail resources where possible for training CHVs to be undertaken by the respective county government. On purchase of medical equipment of level 3 and 2 health facilities, we have agreed that the Ministry of Health will pass conditional grants to county governments so that county governments are able to purchase those equipment through the normal procurement process. On strengthening primary health care, we have agreed to get a mechanism that guarantees financing for primary health care and preventive and promotive health to achieve UHC. Then an investment case for primary health care comprising the cost of offering preventive and promotive healthcare per county should be developed. And number 3, under strengthening primary healthcare is to ring-fence the funds for primary healthcare facilities to offer quality services. And number 4, to invest the funds raised by health facilities back into the facility to motivate the facility teams a deliberate effort that will ensure funds collected at primary health care facilities return to the facility 100%. Number 5, start the gatekeeping mechanism through the primary care networks. And lastly, under strengthening primary health care, setting up a county and a sub-county level surveillance structures and financing for timely epidemic preparedness and response. On intergovernmental participatory agreement, what we call IPA, we have agreed to develop a new IPA for a period of 3 years between the Ministry of Health and the CECs in charge of health to be finalized within a month, then escalate to the Council of Governors. Those are the 9 issues that we have agreed today, ladies and gentlemen.
Thank you very much, Governor Oparanya. I think that that summarizes in a nutshell what we discussed today. There is a lot of work to be done, as we have said. There is a new baby in town with teething issues and so on and so forth. But I think that with the cooperation that we have and with the agreement that we have here today, we can start the ball rolling. But even as we do so recognizing that we are still in a pandemic stage. We still have a virus called COVID-19 that is causing havoc in our nation, even as we stand here today. Our people are still falling sick. And as I mentioned yesterday, we are still witnessing a huge upsurge in COVID-19 cases in the country. Our positivity rate has continued to rise, which means that the disease is spreading among our people at an alarming rate. It is disheartening to note that counties that had very low rate of COVID-19 infections and seem to be on their way to stamping out the virus have suddenly made a turn for the worse. As noted before, this surge can be attributed to the failure of majority of our people to adhere to the Ministry of Health guidelines on the containment of this pandemic. Colleagues, we need to agree to reverse the situation by mobilizing as many as we can through all means possible to encourage our people to adhere to containment measures. As at yesterday, a total of 52,613 people had contracted the virus in our country. That's not a few people. And while we have lost 963 people as a result of the same disease. And of those figures, that is 50,906, which is 97% of the people who have contracted the virus. Those are local transmissions. Nairobi is once again leading the counties with the number of those infected at 25,226 cases. 2 weeks ago, Nairobi had only 21,976 cases. Nakuru now is emerging as a third county with a serious situation. Mombasa has once again also continued to increase the number of cases that they have recorded. Other counties which are also witnessing an upsurge in cases include Uasin Gishu, which has recorded to date some 781 cases. So in a nutshell, what we can see is that across the country, Kisumu, Trans Nzoia, Turkana, Elgeyo Marakwet, West Pokot, all these counties are encountering new surges in the country. Last week, we said that we are staring at a second wave of this disease. I caution that the sooner we change our behavior, the better, since we risk rolling back the gains that we have made fighting this disease. And as you can see from the reports we are getting, this is not a case that is unique to Kenya. Globally, the disease is on an upward surge. And I reminded fellow Kenyans what happened in Spain in 1918, where the Spanish flu, originally, the first wave killed 73,000 people, while the second and third waves killed over 50 million people. It is our hope and prayer that this is not what we are facing at. Today, we also have lost some 17 patients, bringing our total fatality to 981 people. On behalf of this list team standing here, we offer our sincere condolences to those families. We now have in the country some 1,119 patients who are admitted to various health facilities countrywide, while 4,440 are on home-based isolation care. 41 patients are in intensive care units, 26 of whom are on ventilatory support and 15 on supplementary oxygen. We also today have recorded the highest number of people we have tested in a period of 24 hours. 1,185 people have tested positive from a sample size of 9,851 in the last 24 hours. We have now developed then over those 24 hours to a total of 53,797 persons, the number of confirmed cases, and heading towards 700,000 in terms of tests because we are at 687,000. We have continued to record persons across all ages with an 11-month-old baby turning positive, while the oldest is 93 years old. We have released some 272 patients who have recovered, 203 of them being from home-based care programs. So, fellow Kenyans, we will be consulting further between now and Wednesday when the Council of Governors and the President have a session in the summit to determine and to agree on a number of measures that we might have to take in order to reduce or at least minimize the spread of the disease. The biggest fear, of course, is a situation where our health facilities can be overrun. But I'm glad to say that in most counties, the containment measures that we have made, the facilitation we have made for development of the healthcare facilities are bearing fruit. We still have large capacities in some of the health sectors where there are very few people who are in hospital in those facilities. I emphasize, and I continue to emphasize, that the new case management is essentially home-based care. And it is important for people to appreciate this, as I said yesterday, that when you are exposed, you will be taken care of largely by your family, especially in circumstances where you do not have symptoms, where you are asymptomatic. Therefore, it is important for us to protect ourselves, adhere to the rules, in order for us not to become burdens to our families or our loved ones. So I want to stop there and take one or two questions. Please state your name, your institution, and who the question is aimed at.
Francis Mtalaki kutoka Citizen TV. We have seen you warning politicians about letting the gun. Maybe have you thought of engaging these politicians on a personal level, given that you have talked to them, they cannot listen? And two, with the Public Health Act in place, maybe why is it hard for the ministry or Kenyans to start implementing these regulations? And also, what is the weakest link in terms of this coronavirus?
Thank you.
Mutai from NTV. What is your reflection on the reports that 10 students from Maranda High School have been infected with the virus? Thank you.
Well, we are waiting for confirmation of those figures before we take any action. But as I said yesterday, we are going to have a surgical approach to the measures we are going to take so that, for instance, if that institution starts recording growing cases, we would, of course, take measures and close the institution so that it doesn't cause further spreads, and quarantine those who have been infected in their own homes. The second one has to do with the weakest link in terms of our fight against COVID-19. It is individual responsibility. That is our weakest single link, because what we are trying to do is to balance so that we do not close institutions. We don't want to close the economy under lockdown so that everybody stays at home, because it's the surest way of ensuring that people do not transmit it. The surest way of making sure that people don't get the virus is to force everybody to stay at home. But at what cost would that be? So the issue is, therefore, that as individuals, we must take responsibility ourselves to ensure that we are not part of the problem. We should be part of the solution. You have been talking about politicians. It is up to us. We have made very clear rules. The protocols for meetings are very clear. The number of persons who are supposed to be in any meeting are very clear. And therefore, the responsibility of ensuring that is the case lies both with that person who has called the meeting, who must take responsibility, and secondly, for that person who has attended, because there are no children in political public rallies. So the person who is attended, the person who has called the meeting, they must both take responsibility. If anybody were to fall sick in those circumstances, the Public Health Act is very clear, and the decisions we make are very clear. We are trying to be patient. We are trying to be reasonable so that we do not create more suffering, even as we try to contain the virus. So if you look amongst yourselves, for example, you'll see who is wearing a mask, who is not wearing a mask. If you are not wearing a mask and you get the virus, surely you are not going to blame the government. You can only blame yourself. How can you blame the government for not wearing a mask? And as I said yesterday, there are those who are saying that the government is not supplying masks. And I have said very clearly, a mask today is part of your dress code. It is part of your, when you are wearing your surwali in the morning, you wear a mask. And you cannot come and tell us that the government is not giving you a mask. That is why you are not wearing a mask. The government has not given you a shirt. And we don't see you walking naked without a shirt because the government has not given you a shirt. So make it part of your dress code. If you must buy something, wachana na socks, buy a mask. If that is what it means, that you have to sacrifice something, wachana na socks, hata hizo. Lakini wachana na hizo zingine, anza na mask. That way, everybody is going to be compliant. Of course, we are sensitive. And we know that there are those we must support. And we will do so. And we have continued to do so. But for instance, if your child is going to go to school, just like you have bought a uniform for the child, part of the uniform is a mask. You know, that is part of the uniform. So going forward, I think we have got to learn how to live with this new normal. And this new normal means exactly that, that a mask is part of your dress code. Let's just make sure that's what we do. If we do that, we can save jobs and we can save the economy. Thank you all very much.
Good.
Coronavirus COVID-19 is a respiratory virus spreading across